Lory Easton earned her master's in clinical psychology at Divine Mercy University in Virginia. She received her Bachelor of Arts in Linguistics from Yale College and her Juris Doctorate, JD, from Yale Law School. A retired lawyer, she previously litigated mass torts cases. She also served on the Diversity and Associate Development Committees at her multinational law firm, which sparked her interest in the psychological aspects of cross-group interactions and personal/professional flourishing. In recent years, she has presented at annual conferences of the American Psychological Association and the Association for Deaf Education and Counseling on topics including cultural humility, non-death loss associated with career change, and spirituality in clinical settings. Her research interests include intergroup anxiety, cultural humility, psychotherapeutic coaching, and peer support for grief. Lory and her husband Bob are parents to 2 young teenagers. The Eastons are members of All Saints of North America Orthodox Church in Alexandria, Virginia, where Lory sings in the choir along with my wife, teaches Sunday school, and leads charitable outreach projects. Lory is a founding board member of Focus North America, a Fellowship of Orthodox Christians United to Serve, and continues to serve on its board of directors and programs and development committees. She also frequently presents reflections for OCAN, Orthodox Christian Attorney Network, monthly Women's Coffee Hour. Hang on, there's a comma missing. She frequently presents reflections for OCAN and monthly Women's Coffee Hour as an expression of her heartfelt commitment to the spiritual well-being of Orthodox professionals. So much happening. We welcome Lory to read her paper.
Father knows my husband, who would say that all of that is by way of saying, I'm a stay-at-home mom, but I have very expensive and very intellectually engaging hobbies. So my paper is entitled Beyond Cultural Humility, Embodying Humility to Facilitate Healing Across Differences. Our society is increasingly diverse, and this means that more and more we encounter and interact with people who do not share our sociocultural backgrounds. For healing professionals, it seems obvious that we must be equipped to provide help across differences. And among healing professions, there's a clear consensus that multicultural competence is an essential part of professional competence, although the specific components of such competency are still being defined. Recently, the concept of cultural humility has emerged as an aspect of multicultural competence. This development has coincided with increased attention to humility more broadly as a psychological construct, supported by the positive psychology movement. Recent findings show psychological benefits associated with humility. And in particular, humility appears to strengthen interpersonal bonds, including when differences may challenge the relationship. Orthodox Christian anthropology helps us to understand the challenges that we so often encounter in making connections across differences. And Orthodox teaching regarding humility shows how we can overcome those challenges. This Orthodox perspective explains something that seems countercultural and even counterintuitive. Humility is liberating. Rather than diminishing a person, humility expands that person through connection to the transcendent. This can happen when one's frame of reference extends beyond the self and even other people to an encounter with the profound humility of the incarnate Christ. Freedom from fearful concern for self provides a secure base from which we can be open to God and to our neighbor. And from that foundation, a healing professional can bridge even daunting sociocultural differences. All too often, cross-group interactions do not go as we intend in the clinic and beyond. One reason for this is what I call difference anxiety. Difference anxiety is a cascade of stress reactions that often arise before and during cross-group interactions. These stress responses arise precisely because we care about how others perceive us. The problem is that vigilance, guardedness, elevated heart rate, cognitive impairment, and other stress responses can proceed to make the cross-group encounter awkward and uncomfortable for both of the participants. Obviously, this can adversely impact interpersonal relationships. And for any healing professional, this disruptive phenomenon can interfere with establishing the critical therapeutic bond with the patient or client. From an Orthodox Christian perspective, the spiritual origins of difference anxiety are clear. In our fallen state, we experience ourselves as the center of the universe. And this interferes with our ability to live relationally to God and to our neighbor. Orthodox Christian anthropology affirms that we're created to live as persons in communion rather than merely as individuals. But far too often, we choose to pursue a disordered identity, separated from God. When we imitate Adam and Eve and attempt to achieve the fullness of human existence without God, our lives become consumed with desperate, egocentric focus, and we suffer death. Of course, this scares us. So we become fearful and defensive. I must defend my all-important self, even at the expense of those around me. But at the same time, we still crave connection to others because we're designed to be in communion. And this results in a tragic, divisive paradox that persistently plagues humanity. We attempt to affirm ourselves by excluding and even dehumanizing others. We create in-groups and out-groups out of literally nothing, and we perceive potential threat from those who are different. God himself has repeatedly revealed to us that this is a problem. Both Old Testament law and New Testament teaching are unambiguous. How we treat strangers matters. But even when we know these teachings, even when we genuinely value openness to others, our fearful self-preservation can manifest in conscious and unconscious reactions that make it hard for us to build relationships across socially relevant differences. And these differences aren't just race, and perhaps aren't even primarily race. Differences in socioeconomic background, education level, religion, gender, sexual orientation, mental health status, physical ability, country of origin, native language, and even differences in age and developmental stage all can be barriers, and all can make the other a stranger. So to be effective, healing professionals must be able to bridge this gap and work with clients across differences. In the licensed professions, including in healthcare and mental health care, there is clear consensus that professional competence must include some measure of multicultural competence. Specifically in psychotherapy, the treatment must be attuned to the client's identity, culturally sensitive, and responsive to the unique needs of members of minority populations. Multicultural competence involves an appreciation that cultural identity and cultural background are complex and involve the interactions of multiple social categorizations, developmental and contextual components, and related life experiences. Yet, the mental health fields, and I believe other fields as well, have struggled to define exactly what the multicultural competence is that is required for effective and ethical practice. One thing that has become clear is that just learning about other cultures is not enough. Indeed, diversity training that emphasizes the differences between cultures can backfire, both by exacerbating the stress response of anxiety, difference anxiety, and also by providing an excuse for prejudices. For example, unconscious bias over which a clinician may believe he has no control. Overemphasis in training in specific cultures further may reinforce stereotypes and lead to case conceptualization that is rooted in categorical assumptions rather than in the patient's unique identity. More importantly, even a nuanced appreciation of the client's identity will not be useful unless the healing professional's attitude and behavior permit an interaction that is truly client-focused. Cultural humility has emerged as an aspect of multicultural orientation for therapists and other healthcare providers. Tervalon and Murray Garcia originally described the concept of cultural humility in 1998 in the context of medical education, and since then it has been broadly accepted as a valuable component of multicultural competence in the medical and mental health fields. Cultural humility involves components that are both interpersonal and intrapersonal. That is, it requires both self-reflection and focus on the other. Elements of cultural humility include respectfulness, openness to exploration, open-mindedness, authentic interest in learning about the client and the client's perspective, and a willingness to ask questions, along with the absence of superior or know-it-all behaviors and assumptions. At its core, cultural humility requires the healing professional to admit that he or she does not know everything about another person. Research shows that outcomes improve when clients and patients see their providers as culturally humble. The culturally humble healing professional is also attuned to his own culture and background and how that may influence the therapy process. Each professional brings to the clinic his or her own beliefs, values, and views of the world, and this perspective frames the clinician's approach, how to understand the person's psychological distress and how to help someone make life changes. So cultural humility challenges the healing professional to be genuinely open to the client's view of the world, including when differences between the client and the healing professional may lead to disparate goals. A leading theorist on cultural humility has noted that struggles with cultural humility can potentially be exacerbated for Christian therapists, for whom value differences with a client may not just be instances of cultural diversity, but may involve conflict with the therapist's sense of what is true. Cultural humility requires an openness that is antithetical to judgment. It does not demand capitulation. Cultural humility is not tantamount to moral relativity, but it does require that perceived power imbalances and judgments, no matter how unintended, can interfere with healing work. And cultural humility does require clear-eyed self-awareness. Such self-awareness helps a treater to guard against two things that can sabotage a healing relationship. The first is unconscious defensiveness, when a client's worldview conflicts with or challenges the treater's core values. And the second is unconscious attempts to force a client to adopt the treater's view. The difference between expertise and judgment is what is critical here. The patient needs your expertise, but rendering judgment is unlikely to help the patient and indeed undermines the patient's inherent dignity. Cultural humility thus requires the healing professional to hold on to his or her professional expertise and personal values while simultaneously seeking a holistic view of the client and asking, what can I learn from this client that could help me help this client? So how does cultural humility differ from the broader virtue of humility? Well, there's a glib answer, and that's that cultural humility is politically correct, while humility is more problematic. More seriously, cultural humility is a subdomain of humility identified by researchers, along with intellectual humility, relational humility, spiritual humility, and others. It is theorized that cultural humility improves cross-group therapeutic alliances because humility, more broadly, is beneficial in developing and maintaining social bonds. Now, in our radically individualistic society, humility continues to be profoundly countercultural. The current selfie culture of unprecedented self-broadcasting and hyper-focused self-interest has led to an epidemic of subclinical narcissism, for which humility is a potential corrective. But unfortunately, persistent lay conceptions of humility involve self-deprecation, submissiveness, weakness, being a doormat. And in the past, the field of psychology often conflated humility with unhealthy, low self-esteem and produced little research regarding humility as a result. In recent years, research on humility has expanded. following the rise of positive psychology and related interest in character strengths that promote human flourishing. This research shows that humility contributes to positive psychosocial functioning. In fact, one of my favorite quotes recently is that humility was proclaimed a gateway to human excellence. And I'm sure you can guess that that came from the industrial organizational psychology side. but recent research on general humility as a psychological construct has identified several defining features of humility, which include accurate self-assessment, openness to being taught, the ability to restrain egoism in self-presentation, which really is interpersonal modesty, and straight-up orientation toward others. Some challenges do persist in researching and measuring humility empirically because, among other things, self-report measures can be paradoxical in this area. A prideful individual may very well inflate his or her report of their own humility. Nonetheless, researchers have developed and validated a number of measures in humility in recent years, and that has facilitated some expansion of the research in this area. This research has shown that humility is associated with a wide variety of positive qualities, including generosity, kindness, helpfulness, and other pro-social behaviors and attitudes. Humility is theorized to help us create and support social bonds, including helping us to repair ruptures in relationships. What it appears is that humility requires a sense of self that is securely grounded. And that is what allows a humble person to tolerate honest self-assessment without defensiveness. Evidence also indicates that humility serves as a buffer against stressors, including, interestingly, death anxiety and neurotic expressions of religiosity. Humility thus involves behaviors and attitudes that facilitate interpersonal relationships. And specifically in the context of psychotherapy, given that the quality of the bond between care provider and client is critically important in therapy outcomes, psychotherapist humility is expected to positively affect the therapy relationship and to be associated with better therapy outcomes. Beyond warmth and empathy and the capacity to form and repair therapeutic bonds, additional characteristics of effective therapists include self-control, emotional containment, flexibility, and being both professionally self-critical and committed to professional self-improvement, all of which are enhanced by humility. When people, including therapists and other healing professionals, worry less about themselves, they're freed to focus on the needs and interests of others and become more open to recognizing the dignity, value, and potential of those around them. Psychological research also suggests that humility has, by definition, a transcendent dimension. It aligns an individual's accurate sense of self, accurately viewed, as part of an infinitely larger whole. Even outside of any religious framework, this transcendent dimension of humility has been described as involving awe, for example, of nature, and appreciation of some reality greater than the self. Emerging research also suggests that humility is associated with spiritual maturity, in that low humility is associated with higher barriers to relational spirituality and lower security in attachment to God. These insights from social science present few surprises viewed from the perspective of Christian tradition, in which humility, of course, is a foundational virtue, fundamental to human flourishing, and rooted in an understanding of man's telos. While humility also is valued in many non-Christian traditions, a Christocentric vision of humility is uniquely personal and seeks not to diminish the self, but to unite the self to glory in theosis, in deification of created beings by God's grace. For the Orthodox Christian, the perfect icon of humility is Christ himself, the transcendent God, who descended to the ultimate limit of our fallen human condition. Christ emptied himself, taking the form of a servant, being born in the likeness of men, and being found in human form, he humbled himself, even unto death on a cross. God's humility, his voluntary self-emptying, reopens the way for us to participate in his glory. And humility is our natural response to the extreme humility of God. Humility, accordingly, is not just a cognitive state or a set of human behaviors. It arises in a transformative encounter with God and manifests itself as awe before God himself and before the image of God in each of us. Eastern Orthodox tradition places humility at the core of all virtues. Neither the fear of God, nor faith, nor self-control, nor any one of the other virtues can set us right without humility. That's a quote from St. Dorotheus. Patristic discussion of humility reveals that this virtue is both medicine and vaccine. Humility is the medicine for original sin, but it also protects us against temptation. Accordingly, in Eastern Orthodoxy, the process of self-transformation in virtue, our cooperation with God on our struggle to theosis, starts with humility. When we soberly acknowledge our failure at living self-sufficiently, we begin to free ourselves from self-absorption, which in turn frees us to love. Indeed, only through humility can we transcend the limitations of our self-centeredness and see the image of God in others. So how should a healing professional embody humility? Let's just get one thing out of the way right now. It's not by making a full body prostration in front of your patient or client. If I were the abbess of a monastery, of which the probability is precisely 0, I might forbid anyone on monastery grounds to make a prostration anywhere that it might be seen by anyone else. Demonstrative humility is not only an oxymoron, it is relationally toxic. The prophet Joel tells us, "Rend your heart and not your garments." As with all things, the praxis of humility must be modeled on Christ. Christ came to serve. He washed the feet of his disciples. He fraternized with outcasts. This means we must see no work and no person as beneath us. And the starting place for anyone seeking to follow Christ is actually the starting place of Christ's ministry. He tells us to repent. Like humility, repentance is not a comfortable word in our society. It has overtones of punishment. But we know that the Orthodox tradition instead commends metanoia, changing your inner self. Now, my dearest Greek friend tells me that based on the etymology, what metanoia really means is get over yourself. Only when we truly move beyond our egocentric view are we able to connect with God and with others. This requires a decision, but it's more than a decision. And while heartfelt, it must also be more than a feeling. It must be embodied and enacted in love. We in the healing professions have some obstacles to humility, which include diplomas and certificates framed on our walls and initials after our names and accolades and letterheads and so many indications of accomplishment and ability. But we Orthodox Christian healing professionals also have an extraordinary secret weapon to help us seek humility in our professional contexts. We know that we are not the ones doing the healing. No matter how smart we are, no matter how well trained, how well supervised, how experienced, how gifted, we are not doing the healing. It is Christ who heals through us or even in spite of us. Again and again in the scriptures, we hear that Christ healed the sick upon the request of a third party, a neighbor, a friend, a relative, the centurion. This is our model as healing professionals, to bring those who seek healing into God's loving presence. Now, I am a lawyer by training. When the lawyer attempted to trap him, Christ did not take umbrage. Instead, he responded in profound humility, and he described the essence of humility. A flourishing human being loves God with all his heart, soul, and mind, and loves his neighbor as himself. Humility frees us to love authentically. And for the Orthodox Christian healing professional, Humility can be the secret weapon that helps us create and to preserve fruitful healing relationships, even across very challenging social differences.
We've got a couple of minutes for a couple of questions before his Father Isaac?
Yep.
Okay. So just maybe one or two questions. Question for
Can I just say a comment then?
Yes.
Okay. I just did a part of a panel on AI, and at the end, how do we stay human in the era of AI? And one of the things I put at the end is humility. Humility and prayer. But I'm going to go back to your talk to get all the right words to say about humility. And thank you very much.
Well done.
Spot on.